I actually got my inspiration from one of your videos.
Okay.
I was caring for a young girl who was admitted for, and she was Muslim. And when I was in her room in the morning doing my morning assessment, the CNA came in to get her vitals and to get a blood sugar. And I could tell that she just seemed very uncomfortable. She had her mom and her dad there with her who were doing all of her speaking for her, which I recognized was just a part of her culture. But I could tell she was very closed off. She was kind of like holding her arms in and she just seemed uncomfortable. So the CNA was male, and I just let him know, hey, don't worry about it. Like, I got her vitals. Like, you can go help the other patients. And after I said this, and I started taking her vitals and he left the room, I could immediately tell she relaxed a bit. And I completed her vitals and all of that. And then when I went outside the room, I went and found the CNA and I let him know, hey, I got her vitals for the rest of the day. I think she prefers when a woman does her care instead of a man. So don't worry about it. I can take care of her for today. And that was a time that I had provided culturally conversant care.
Hmm. Like I like that you kind of watch her nonverbals, but I feel like if you confirmed it with her or asked her,
Okay.
um, yeah, because they don't want you to assume
Okay.
once he leaves and like once you've seen all these nonverbal cues to just ask her,
Mm.
would you be more comfortable if I did your vitals for
Okay.
today?
And like for the rest of the day, I did them instead of like,
Yeah, like some patients prefer to have a female provider. Would you prefer if I did your vitals? And then if she confirms that she feels way more comfortable with a female, then that's something that you could pass along to the charge. Like, by the way, when you're making the assignment later,
okay,
she definitely prefers female providers if possible.
thank you. That'll be good.
Yeah.
A time that I delivered culturally conversant care was when I had a patient who he unfortunately was intubated and sedated, but his family was present at the bedside and they were all speaking. And I speak a little bit of, so I had noticed that the wife of this patient was a bit more withdrawn and had a more depressed demeanor than I was used to seeing because I had cared for this patient a number of times, so I was very familiar with his family. And I had noticed in his room that they had little like religious symbols and crosses and the Catholic Mary up in his room. And I asked the if she followed a religion, just to I didn't want to make any assumptions. I wanted to ask her what the family followed. And she told me that they were Catholic and that they really like to pray, and that's why they had these little symbols up. So we had a chaplain on the floor that I would frequently see, and I went and sought him out that day and just said, I have a family I think would really benefit from you talking to them. And he ended up coming into their room and speaking with the and they actually set up a time to have it was like a prayer ceremony that was very unique to this family's religious following. And so the came in and the was there, and with the chaplain they did this prayer, and I think that it really impacted this family in a positive way because after that she just looked like a whole different person. Her face was lit up with joy. She was even thanking me because she knew that I had gone and got the chaplain. And so I just made a little note in the chart that this was important to them and to seek the chaplain when possible. And I think for me, the learning lesson from this experience is that it's very important to look for those symbols and to look for ways to incorporate a patient's spiritual beliefs into their care and plan it into their care for that day. So planning that prayer into this patient's care that day really made a big impact and made what was a very difficult day a more positive experience for them.
During the scheduled prayer time, put a little sign on the door that says, please check in with the nurse before entering the room. That way you're able to field like,
Okay.
let's say right during that phlebotomy, you wanted to come in and draw a lab that could wait 30 minutes, you know,
Okay.
let's say they
Okay.
were
Yeah,
going
I like that.
to, yeah, just something to kind of protect that time so that you're able to cluster the care around the time where you want them to be able to have just for their prayer practice. And you could say
I see.
the chaplain thanked you for the referral and said
Mm.
that they're going to continue to visit with the patient,
And they did, so that
today.
was really good.
You could
Okay.
also say that you love when your patients are willing to share their preferences with you like that. It could be about anything, whether it's their prayer practices, the music that they grew up with, the kind of
Mm-hmm.
food they like, even something as simple as their water temperature preference is really helpful to
Yeah.
know because then you can come in each time with meds with, oh, I have your ice water or I brought in some hot water and they're like, oh, you remembered?
Yep. Yeah.
It
Mm-hmm.
helps just make
Okay.
care more patient-centered when
Mm-hmm.
they're willing to share a little bit about what makes them comfortable. If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview. What have we not gone? Oh, we haven't gone over the cultural one, the one where they're like, tell us about a time you provided culturally conversant care.
So I'm part Chinese and part Thai. So the patient that I had at this specific hospital during my clinical rotations, she was Chinese, and the family, although she didn't really speak proper English, it was more like broken English. I came and introduced myself to the family and I was like, hi, my name is, and I'm gonna be your student nurse today. And when it came to medication time, at least, I noticed that I just remember from the top of my head, like Chinese people, they really enjoy like their hot, warm water with everything that they drink. So at this moment, I asked the nurse, is this medication okay if we give it with warm water? And I asked the patient's family, like, hey, would you like some warm water instead of room temperature water? Because I know, like, in the pictures we give, it's like ice water. So what I did was I gave her warm water because I know that, like, they're more susceptible to be drinking water if it's warm. And I asked them if that was okay, if you took it with this medication. And she said that's totally fine. And I think at that moment, it showed that I was kind of more aware of the culture she was coming from. And it just made me feel like I was able to help her out in every way possible, even the smallest details.
So I used to kind of suggest this stuff, and then one of the new grads I was working with, he was like, I really don't like that. I was like, why? And he was like, okay, so for example, my girlfriend is from Argentina and I wanted to impress her. So
Yeah.
the first date, I took her to a steak restaurant because she's Argentinian, right? She loves steak. I realized once we had ordered, she hates steak. And I felt so dumb. Thanks.
Oh,
Like everyone in the same country obviously doesn't like the same things. So uh ever since then I'm like, oh right, like yeah, I guess you kind of have to talk about being mindful of cultural preferences, but
mhm.
then getting to know your patients as an individual, like um so I guess maybe just like asking, right? Like, do you prefer room temperature water, ice water, hot water?
Okay.
And then maybe talk about how they got excited realizing like, oh, I can have hot water. You guys have that here?
Okay.
Mm, no one's offered that to me. I'd love some hot water. And then that you kind of noted like, oh, that that is their preference. I'm gonna, you know, make sure to provide at least offer hot water every time I'm in the room and pass that along and report. Um, say something where it's like you weren't just like, oh, you're Chinese, you probably want hot water. It's
Okay.
like let me
It's
ask your preferences because it likely, but like I'm not gonna assume.
Okay, so like just reword it's just like you
Yeah,
notice
just like
notice he
rewording.
was from a Chinese background, and when it came time, like it came time to administer medications, I asked her if what type of water she would prefer, like whether if it's cold, warm, or hot. And when she heard hot, like I saw that she really got excited, and she asked me like, "Oh, is that allowed?" And I was like, "Yeah, of course." So then from there, just it taught me to really be aware of like our patients' cultures, and these small little details can really help our patients feel more welcome and like more comfortable at this hospital. And,
Yeah, and maybe like get to know them, be mindful of their culture, but get to know their individual preferences. To and then maybe talk about how you love any opportunity to bring what brings them comfort from their home, from their culture, more into their bedside care to make it more
Okay.
patient centered.
Okay, that makes sense.
Yeah.